Mackenzie, this is Luke, and this is my handler Sarah, and today we're going to talk to you about manual restraints. So before we get started, I want to talk about safety a little bit. Generally when you use manual restraints, it's because the horse is nervous, something's upset him, and he's not behaving properly. So you want to be careful where you're at. You never want to stand in front of the horse. You always want to talk to him and make sure you know what he's doing and that you're not in the strike zone in case he wants to lash out or move forward. So the very first manual restraint you want to have is a halter lead rope. You always need this. No matter what you're doing with the horse, you should have this on. So first off, we have the chain shank, which is like the lead rope, except it gives you more control of the horse. So to do this, you're going to come from this side of the halter. You're going to go up, over, down, and up. And you're going to have the clip facing outward so you don't cut your horse or hurt your horse with this. And then you're going to come over here and just gently pull down. This gives you control of the horse's face, and it is stronger than the lead rope. Next, after the chain shank, we have the lip chain. And remember, while we're doing this, you never want to stand directly in front of the horse. Always stand to the side and be quick and efficient while doing this. So for the lip chain, you're going to go in, you're going to go down, and then through this and up with it pointing outwards. So you're going to just open the horse's lips and gently pull down so it's on the horse's gums. Good boy. While you're doing that, you're going to want to pull down gently. Don't pull down harsh. It would hurt them even more if you did that and cause them to raise their head. And when you're doing this, you want it to be 10 to 15 minutes, no longer than that, as it'll start to cause the horse pain. Another form of this would be the lip twine, which is basically the same thing. You have a thing of twine. You'll come through this part of the halter, go down. Actually, I take that back. You will tie it to this part of the halter and then put it down here. And then some people like to lift up their gums, put the twine in, and then go through here. Or some people will tie it on this side, put it through this, and then lift up their gums and pull down and twine them like that. And again, you want to do that 10 to 15 minutes, no longer. Next, we have the twitch. There are two different kinds of twitch, the rope and then the chain. The chain is definitely more severe than the rope. Now when you're doing this, you always want to make sure you have a hold of it. You want to pet your horse and make sure he knows what you're doing. You're going to make sure you stick your pinky out so your fingers don't get stuck. You're going to pet his nose and then gently grab a hold and twist. You're going to keep twisting until you get a hold. Once you get a good grip, hold it and then release. Again, you don't want to do that more than 10 to 15 minutes and rub it a little bit until he's a good boy. There's also the humane twitch, which is smaller and you can connect it to the halter. It's more handy if it's just you, so you don't have to have someone holding it, but you should have a handler anyways. So next is the shoulder roll. This is a quick form of a manual restraint. It's easy and you don't need something else to do it, just your hands. Only problem is this, if you need to do it for long, it really hurts your hands and you can't hold it for very long. So you'll just find the skin, take a hold, and roll. He should move away from you like that. That means it's doing its job. You could do this for clipping. If you're trying to do his ears and he's not paying attention, just grab a hold of him a little bit so that way his mind is off of the clipping and onto you. Same with all these forms of manual restraints. The next one is the leg lift. You could be doing this if you're clipping a leg and he doesn't want to keep it down, or if you have a wound on a leg and he doesn't want to keep it down. So you never want to pick up a back leg as you're in the strike zone, and that could be really, really bad, and he could strike out and kick you. So you always pick up the front one. If he's not going to keep that right front down, you pick up this left front. If he doesn't really keep that back left down, you pick up the left front. So basically you pick it up just like you're going to pick up a horse's hoof to to pick out their hoof, you'll just pick it up and you'll hold it until you're done with whatever you're doing. And then you'll gently set it back down. There are two other forms of restraints. You have verbal and then you have chemical. Verbal is just talking to the horse. You can be talking calmly and nicely, like, good boy. Or you can growl a little bit and like, quit that. Or whatever you need to do to get him to stop. Chemical restraints is like Ace and Rompin, which you give to drug them a little bit so they're calm. Like if I wanted to clip his ears and he had nothing to do with it, I'd drug him a little bit so that way I can get the job done really, really quickly. Now remember, when you're doing this, you need to be safe. Always let the horse know what you're doing and where you are. And just remember that sometimes you're not going to get clipping done. So just be careful what you're doing.